Thank you, Chair. Good morning, everyone. I'm very pleased to be back to your wonderful country, not only because it's here, but because I think that France and Greece share a lot of things. We have maybe a lot of demonstration in those countries, but also we are some countries about human rights, and I do hope that it will continue like that. Having said this, because I know that I was one of the last speakers, maybe I will astonish you, but I will probably not speak about projects. I do not agree with totally with Henrike saying that eHealth strategy is based on projects. Yes, it is, but we need to have a pilot, as he said already. So the reason why I'm here is because I was asked to make this speech about the French eHealth strategy, and the second reason is because my department is responsible for this strategy. So I will try to explain a little bit more the way by which we intended to do so, rather than to describe all the project, because more or less you have already a very nice description from other countries, and we are not so different in France. One or two figures because, before I just jump into the eHealth strategy. First of all, you could see on this slide that there is a lot of title of ministries. I am in between of all those ministries, so it's not easy, but in some cases it could be helpful because then we have to be open-minded because we just could not stay just for health or just for job or just for people. We need to try to be as possible open-minded. One more difference that the reason why I could not explain everything is you probably know that in France we are over 65 million inhabitants. So the previous speaker spoke about their country, and if I just take Paris and the suburb of Paris and the Grand Paris, there is most inhabitants than in some countries that you heard for. The territory of France, you could pick up all the territory of the other countries and put in. So why I say this? Not because we are great, but because you understand that it could be quite difficult to make it happen in such large country. Because also we have some reform very soon. The last one was about the territorial reform, and we jumped from over 20 regions to 13, not only for health, but globally. So you can imagine that in this period, it's not easy because you have less responsibility for the same people, and when you have 2 or 3 chiefs, you get only one. So this is the period in which we had to organize this reform. Another feature from France is that France is an old country, middle of Europe. You have heard about our Napoleon and this so-called centralized country, a Bismarck country, but nevertheless we decentralize more and more. And it's not so easy because the culture of the people is maybe not so on this mind. Nevertheless, we had a very huge history. And from the health point of view, in 1996, that's far away, we intended, at that time there was no secure internet and no internet really for the people. We set up the first secure internet for the purpose of health, and we organized identification card for insured person and for health professional. It is still in place. So why I say this? Because we also have this, is nice because we need to have an infrastructure, but it's an old one, so we have to cope with a lot of changes, and it's not so easy. It could be easier for a small country who can pop up from more recent years. It's not so easy for them, but nevertheless, they do not have to comply with such legacy applicational culture. So it's another thing that I would like to tell you. On top of this very old infrastructure, by chance, we had some very good law, if I could say so, in the early 2000. We set up a law saying that, and it's true right now, obviously, that the data belongs to the patient. And at that time, was not so common to have this. And on top of that, in 2004, we decided that each patient could have access to a so-called e-medical record, a personal one. So this is a lot of things, and you could know that since there, the technology evolved, the civil society evolved, and then we have to cope with that. It was good, but not up to date. So that's more or less the story that I would like to share with you. I was asked to speak about the eHealth strategy. So as some previous speaker explained to you as well, in order to be able to do so, you need to have a strategy, and the strategy could not be set up if you do not have a goal. And with such different ministries and a very old culture, it's not so obvious to have one goal. And then you have to decline this in clear objectives. You have, for that, to have in mind a long-term vision, and with the politician is not always easy to do so. And you have also to give visibility to the different actors, and I mean not only the citizen and the patient and health professional, but on one shot to the industry, because they are the ones who are helping us to make it happen. And this needs to be built on consensus, and because people are not really all the time together, it's not so easy. And when you have this, then you will think about what is e-health, if I have a strategy. Is it a health strategy? And why a E? And the ultimate goal, if I could say this, is not to have an e-health strategy, but just to delete the E and to have a health strategy building upon what we have as IT. So for that, the precondition and the prerequisites are more to have a strategy, but the strategy has not to come from the brain of whatever administrative or very nice and ambitious politician or health professional, but based on the health demand, and you know that the people now have a high level demand because they travel, because they know everything, and because they have all in their pocket, it was mentioned all the time in the previous speech, a smartphone. So we need to deal with that, but not only on the individual level, but also at the population one, and objectives, the project, the way to make this is quite different. It's different to organize things for one person and for at the level of the population, you know this. And what we have tried to do is to transform our old culture and big infrastructure and quite a lot of different laws into a capitalization of this in order to make things happen. But for that, we try to be imaginative in the term of innovation and new business model, but we are still thinking about. As I told you already, the existing landscape in France is huge. I do not want to go through all this, but we also have a constitution with human rights. We have a heavy legal framework. I'm not here speaking only about health, because I think that if we want to have this type of strategy, we need to be aligned with all the legal framework, not only in our country, but also at the EU and international level, and I will come back to that afterwards. I also tell you that in France we have less regions since 1 year than before, and you could imagine that we have to reorganize everything, and part of our health strategy is to make it possible right now, because people don't wait until we have think about the new way of working together if there is only one region where there were 2 or 3 before. And it was one of the reasons why the consensus building was needed, but also was quite difficult because people were in the middle of nowhere, and if you have a stabilized position, you could still go forwards and think for the future. If you don't know where you will be in the next month or week, it's not so easy. And so the things that we have built upon, as I told you just before, is the fact that our technical infrastructure, the existing one, were and is still aligned to our organization. But because we changed this number of regions, we also have to change this technical architecture. So we could not say, okay, this is a building block that we could build upon immediately. We have to change everything in the same time with people who are thinking about their next position rather than, okay. So that's it. And having said this, just some few words instead of going into too much detail, the way by which we have worked with all the actors. First of all, the green circle here is to explain to you that what we would like to achieve is services for individual or for the population. On the back of the slide, the bottom of the slide, you see this infrastructure. And in between, this is the system and the application and the way by which we try to use the infrastructure to be able to provide services. The first consensus building we had is to say, for that, we need to have an infrastructure. So because it's old, we need to rebuild it. Because of this reform of the region and some others, we need to update this. So it will be the responsibility of the public authority. And when I go back to say, we are, my department, responsible for the eHealth strategy, we also clarify with the ministers that there is someone who is responsible for this infrastructure and to update and to maintain this infrastructure over time, and it will be under the public authorities because everyone could be sure that it exists on long term and do not have problem with the financial part of that. Then, jumping into the service, we establish, and we have an agreement on that the services to the citizen, to the population, and to the health professional could be either public or private. Could be both, but in any case, it has to comply with the same rules. And in order to be able to do so, we built upon some care providers, a lot of. They have to manage different systems. The system has to be compliant with the rules. The system has to be interoperable with the infrastructure that is up to date and aligned with European and international standards. And here, this is pure private, unless someone from the public would like to do so. It's the product of the market. And this was the basis of the consensus building for the eHealth strategy. So back to the health or eHealth, you may know or not that this eHealth strategy I am trying to explain to you what is it, is just brand new. This eHealth strategy was approved by our minister this summer and was presented in France only last month in September. And why this? Because before that, after the territorial reform, we set up a new law for health, a modernization law of the healthcare system, and this law was published after long debates in the parliament in January this year. And what I say to you that to make an eHealth strategy, we need to have a health strategy. This one is brand new. It's good, and it's less good for some other reason. I will explain just after. But because we have this, and we were in this position to discuss because we are in the ministry, and to accompany and to propose some element in the health law, the eHealth strategy is based on components that we put on the health law. Some example for you. For example, we have a mandatory interoperability framework and type of interface. Not to say that the technology is put in the law, but if you want to set up or to organize from the care provider's point of view some services, you have to comply with some rules, and these rules is based on some kind of eHealth part. So I give you on this slide some elements on that, on security, data protection, and so on. And in each case, there is clear responsibility and there is some clear deadline when you are supposed to do so. This is the good part. We are on the way because it's brand new. The less good part is the law was published in January 2016. And in this law, there is a big part about security and data protection. And you may know that at the European level, the General Data Protection Regulation was published in April this year. So because we could not wait for, there is in our law some disposition about patient consent, traceability, and so on that has to be fine-tuned, not so big changes, because I was with a team on the negotiation team for the data protection regulation as well. But nevertheless, we have to make some adjustment, and probably in the eHealth part as well in the next future. As each speaker, we have this type of diagram. It's not for you to read it at all. It's just to explain to you that having this slide with the green, the blue, and the gray box, this is the tip part of the iceberg. When we go deeper enough, because we are an old country, we could see all these different actors, all these different places, the repository, the framework, and everything that we have to cope with. It's all our legacy world, if I could say so. So you could imagine that when people making this or are responsible for something and you change it, it's not easy. So I will finish with that, saying that we try to simplify. And now I will explain the method, because for us it was more important to be sure that the elaboration of the eHealth strategy was well done than, if I may say so out of the record, than the content itself. Because if the people are willing, if they know why, if they have a position, if they are ready to move forwards with the strategy, then if the content is not so good, we could change it. And we have to change it anyway with the change of the society or the technology in the next years. So we try to go beyond the ministry, beyond the ministries on other sectors, and not only to cope with the patient and health professional, but with the civil society, with the industry, and also with the family, because social care is also already part of the health care, even if the culture is not the same and the organization as well. The way by which we are making this is co-design this eHealth strategy. I know it's the word that everyone would like to use, but really we make a lot of iteration and versioning about document or consensus in order for the people, including not only to have the understanding, but to be sure that the wording corresponds to what they have in mind. And it's a semantic problem between people, but it's very important to make it happen if it is for the long run and the strategy is not for just 1 year. So, to be simple, what is it? eHealth strategy is about health and IT. And if you go on the right side of this slide, you will see that I put health professional and health professional providers information system. So the first thing was, as it was also said by the other speakers on Cyprus first, that we have to equip or re-equip with new instruments all the health professional and the hospital. Just to give you an idea, we do not have two university hospitals. We do not have 50 or 76. We have over 1,100 hospitals. So you could imagine that in this case, if you have to reshape this, it takes time and it costs a lot of money. So it was the first time we have done. The second one was telemedicine in France. I told you that we have a lot of law. In 2010, we set up and published a law on telemedicine to recognize for the first time, and we were the first country to do so, definition of telemedicine, definition of 4 different types of service on telemedicine, and allow finally the hospital and the GP to use this with a very strict contract and process between them and with the regional level, because it's more at the local and regional level that you could have this. And now we are moving in this new eHealth strategy to stabilize this with the reimbursement process. It's not yet done, but it's done for some type of telemedicine act. And we are working very closely with the companies and also with the pharmaceutical industry for the telesurveillance elements. I will leave for after if I have time. If not, I will answer to question if there is time enough as well on mobile health. Because you could imagine that in our country we have a legacy application and framework and culture, and mobile health is one way, as it was mentioned also by Ireland and Portugal, to move from this legacy application and to cope with the demand of the people who have on their pocket they have some kind of telephone. So it's one brand new way of making things happen more quickly, because another point that it's very difficult is to have some really in-time response to whatever demand if you have a heavy framework and a lot of department and a lot of hospital and agencies and so on and so forth. So back to the picture I explained to you before. What we are doing in this eHealth strategy, we do not change this 3 type of box, but first we try to support the services based on the ecosystem, and then we give some incentive, financial one, but not only financial one, to the people who are supposed to offer these services, either private, and in this case it could be financial incentive, or in public it could be some more resources and something like that. It was the same as well to promote some kind of care providers for the services who are not obvious one, because the investment could have been huge and then the return of investment could be not so quick. So in this case, we have different type of incentive. We also have to labelize some kind of application or services or make a certification process. And also we make call for tenders or call for project, but on behalf of the global eHealth strategy. And last but not least, we change, as I told you, because there is a strong link between the eHealth strategy and the health strategy. We set up some new elements on the legal framework in order to support this new type of working together on a consensus base. And we update the repositories. For example, we have an online repository for healthcare professionals, not only on the diploma and static one, but also to know if their specialty, where they work, if they have some problem somewhere, and so on and so forth. And we have some kind of permanent address in order to be able to have some kind of alert and vigilance system. And on top of that, on the left part of the slide, you could see that it could be possible only with the strategy. I already told you about that, but we set up a new kind of governance. Before it was only the ministry or the public authority. Nowadays we have everyone on board for this governance. So I told you it's quite summary about the rest. We built upon health policy orientation to make the eHealth strategy with the key role of the actors. And we have one place where people met in order to organize this new national framework. And we pay attention on the link between the national and regional level for the reason of the territorial reform I explained to you just before. So what is in it and how it is structured now, because I tell you that I will not speak too much about project. There is 2 axes to summarize what I try to explain about the context and the history. The first axis is that we intend to propose some action to serve the health policy, because it's health strategy finally with help of IT, for 3 types of actors, patient and citizen. health professional and health professional providers, and also the one who manage the system, and back to the administrative who have to pilot some kind of financing issue at the internal level. This is the first axis. The second one is to be able to create a positive environment for the eHealth deployment with the innovation in the so-called whole country. So there is an open initiative. You could, and it's already since some months, but it's still open, propose some initiative and a way to co-construct this. So the orientation, as I told you in the slide with the circle, was first to focus on the equipment, new one for this number of hospitals. And we have a special program, a numeric hospital program. It's the second version. This is really a program in which we have given a lot of money to the hospital. If they follow some very strict rules, they could have some kind of new organization, new equipment, or rebuild a hospital like it was mentioned by Ireland before, in order to cope with the new demand. We also invest a lot on coordination of care, a new eHealth medical records. We also have a so-called territory organization with the new territorial reform, but in this case to link all the different hospitals that belongs before maybe to different regions. They have to cope with a new network right now. It's not so easy between a big hospital and a rural hospital to work together when they were not in the same region. And we also set up other project regarding a secure messaging system between health professional and the private and public. And not finally, but the last I mentioned here is to renew the identification system and the authentication system for the patient and the citizen. Another elements, maybe a big project about that I would not detail much, because it's more or less like you have heard about Ireland, about a portal for patient information. In France, it's a brand new unified one, using the smartphone, using Twitter and so on. It's just at the beginning, but it's the first time that we try to make some kind of fusion with all the different sources online. We had since 2 years also a portal and where you could see where your hospital is in terms of good or not so good healthcare on different specialty. But on top of that, we propose one portal where we could do everything. And obviously, at the population level, we have to more and more get on the data, not only big data and open data, but to be able to valorize the data that we have already. And it's not easy to change once more the culture, but we do it first with the first program regarding vigilance and alerts. And people understand very well what is behind, and in this case, we could build upon for other type of application. So what is in the heart of this strategy? It's not only citizen-centered, as anyone could say every time, but we could do this only if there is benefits for the health professional as well, because in this case, the data produced are the right one, because if people are interested in, then there is less error than if not. But it also be possible only if we facilitate the work for the economic actors, because if there is no solution, forget it about making things available for the patient. And finally, we try to modernize the instruments, not only the administrative one, but also this one, in order for the patient to be paperless. And I do not have slides with a lot of paper before and no paper now, because it's not exactly the reality, but I'm in line with my colleague on that as well. So, citizen-centric, what does it mean for the individual? It means that we try to facilitate access for them through the portal for the information, but also through telemedicine and telesurveillance, as I explained to you before, to simplify the administrative process and to simplify and unify the access of the information, not only for the health professional, but also for the patient. The information and the personal data of the patient on time. And also we try, as it was also presented before, to have some kind of indicators, but not only indicators at the level of the hospital or the region, but try to propose to the people to be able to follow their indicators, not only the one that they have with the bracelet or with the watch or whatever, but to combine the elements and indicators they make themselves and the one that they could get from the hospital or from the private GPs or things like that. And it's useful for telesurveillance. I tell you that it's one way by which we move forwards through telemedicine, but the second one was to on mobile. And just to say one word on that, we do not make the same choice as Portugal. We decided not to develop any apps because we saw there is so many on the market. But what we try to do, not only at the national level, but also investing at the EU level, to be sure that to be in line with, is to give to the people, to give to the industry, and to give to the health professional some way of judging the apps that are on the market. First, in order for them to know if it is useful for them or not, because you may know that some citizens are more skilled than some health professional, in some cases regarding their own disease. And we could not say there is apps for professional and apps, different apps for patient or citizen. It's not true. This one part. We try to give some kind of, like in the EU level, code of conduct for the industry in order to know which type of rules they have to follow in order to be sure to have the label or to be certified and to put their apps on the market. And not only CE marked, but more than that. And finally, we try to give some kind of more than guidelines to the people to understand not only if the apps is good, but how to trust the apps and what could be done with or without, and what is the margin of error and things like that. So it's not easy, we're on the way, but we think that it's one good way in order for the people to be part of their health and to interact with us, and then we will know what to do if it doesn't fit completely with what they would like to do. So I say the citizen at the individual level, at the population level, we try to promote a collective vision. It's not easy because you have not the same wish and demand if you are ill or not ill. And we try to put some incentive to patient association to be part of the design of the strategy and to be part of the follow-up of the strategy and to propose some kind of assessment criteria in order to know if we still be on a good track or not. And we have quite a lot of small projects in order to push the digital use by patient and by health professional because we need to. Last but not least, we have to train people. Most of the citizens and the patient are very good on that. It's not the case for all the health professionals. And we have the normal way of doing this, and we push on the research ministry and education ministry to have more digital curricula for health professionals, and not only for medical doctor, but also for other type of nurses and so on, and for the social care as well. So, and finally, we try to support and to integrate, it's not easy, the decision support system for each type of health professional that need to have, and there is a very different need on that direction. Because the point is not only to have silos, apps, or application or services, but to be able to integrate this. It's not only an interoperability problem, but you have to think global and know how it fits with the healthcare process and the coordination of care of the patient. And for the economic actors, we establish priority with them. We clarify the roles at the national and regional level. We make call for tenders, and we try to give visibility of the industry in order for the industry to know 3 years in advance where we want to go and how to cope with that and how to interact at the regional and local level. And we published an interoperability and security framework, and it is linked to the health law in order for them to know what is allowed and not, and what are the available standards and what are the standards that we will put in the next future. Last but not least, we have also to modernize the piloting instrument inside the public authorities to speed the development. And one thing in which I need your support, not only my colleague, but you, I think that we are a little bit weak, not only in France, but in some countries, to operationalize the assessment model and method that are now really adapted to this new way of working, to the mobile health and so on, because we could not wait, we could not have heavy methods, so it's one way in which we have to think and invest, I think, and for sure data analytics could give us some kind of insight, but we are here speaking about now and not the future. And finally, because there are pilots in the plane, I tell you that my department is responsible for that, but we act as a secretariat to this committee with all the actors, and this is not only one committee, but one big committee and a working committee, as you could know, but we really act as a facilitator and enabler, and not as the one who decided or published the law. And this is almost my last one. So we update the legal framework in order to be able to exchange this personal information, and we have to fine-tune this in order to be completely in line with general data protection regulation, as I told you. And for that, you may know that France is quite active at the EU level, not only in the legal framework, but also I could have made one slide, not exactly the same as the Henrike one, on our participation in the EU project since early 20. And it's good because it's we learn a lot about there is different way of working, and it's important to know why some other country choose other type of solution. It could help us to update our strategy and also help us to have some more consensus building. When you work with people who are very different, you learn very well how to behave, and it's very interesting and very important. And so we are also member in the eHealth network, the official committee of eHealth at the European level, since the directive on the right of the cross-border for patients. And it's very helpful, and it's also very helpful in a way that there is some deadline on that, and so we need to be ready in time in France for that. So for me it's a big push, and it's good because then I could try to push people to be ready in time. Not easy, but at least we try. And for that, we need to have a consistent framework aligned with the requirement not only of the people, but also at the EU and international level. And we try to cope with that as well. So a lot of things I do not have time to explain to you about the project, but maybe we could have time if there is any question after the last presentation. Okay, so thank you very much.